Folks, we have relied on them now more than ever. Frontline workers in hospitals working to save lives amid this COVID-19 pandemic. But that work is not easy, right? Their normal routines have changed, and even the way they show empathy, it looks different. In this series, we speak with several frontline workers who are pushing through the challenges while providing comfort to others. Tonight, I will introduce you to Raquel Garcia. She's a community health nurse with Truman Medical Center. If you've ever been to a community testing site for COVID-19,
seen hundreds of people today, have hundreds more people coming the rest of the week.
There's a chance you'll run into Raquel Garcia. She's a community health education nurse for Truman Medical Center.
The difficult part for me is getting people to understand how serious this is.
Garcia conducts the tests in these mobile units, oftentimes in what they call hotspots, those zip codes with the highest number of COVID cases. Here, she's walking us through her new look uniform amidst this pandemic.
Have to put on the bunny suit, as I call it, double mask, goggles, shield, everything.
It can be nerve-wracking, right? On a bus that's racked up so many miles and tested so many people. Garcia spends a lot of time separating fact from fiction and calming fears.
That has been one of the most difficult things for me, is seeing people shy away from things because of the fear.
But that fear, Garcia says, is sometimes misdirected. A lot of people are afraid taking the test will hurt. Others would rather not know. And those that should be fearful are often fearless, causing a lot of frustration.
We've had somebody in our community that we went and did testing, and they brought out their entire family from the funeral and got tested. And still, the social distancing wasn't being followed after that. The funeral gatherings, the family holiday gatherings, they think it was just, oh, well, he had something else going on. We're not as sick. So that's definitely been the saddest part, is that death alone wasn't enough to scare you into social distancing. The death of your loved one wasn't enough to keep you at home. That's what's so sad and scary about it, is death isn't even enough to keep people in their houses and social distancing and wearing our masks. We need you to be healthy year-round. The healthier you are, the better chances you have to fight this.
Well, you know, in addition to traveling from site to site, Garcia is also a mom. And like many of you, she's dealing with virtual learning and scheduling. And it can be very difficult for many of you parents, right? If you'd like to learn more about testing via Truman Medical Center, head to our website, kshb.com, and click on this story.